Dentistry is more than just teeth. It's journey of skill, science, and lifelong journey. For students, parents, and young dentists, this conversation truly matters. In this podcast, we'll explore the real journey of dentistry from choosing the profession to navigating dental college, building clinical skills, promoting oral health, and preparing for the future of dentistry in India. I'm Amita on behalf of EduAdvice, delighted to begin this insightful podcast by welcoming our guest, Dr. Sarvagya Chawla, founder and director of Gurugram Dental Clinic and Orthodontic Center, who has also been associated with Apollo Cradle and Fortis Healthcare. Dr. Sarvagya, welcome to the podcast.
Thank you so much, Amita.
Every professional journey begins with curiosity and one decision that shapes the future. Can you tell us about your journey in the medical sciences and your dental college experience?
Hi, everyone. This is Dr. Sarvagya Chawla Jain. I am practicing in my own current setup, that is Gurugram Dental Clinic and Orthodontic Center. I passed my BDS in year 2014, and for the last 12 years, I have been practicing continuously. My interest in medical science didn't begin with a single moment. It grew gradually. I always found it very fascinating about biology and how the human body functions. I took biology as my subject after 10th, cracked CPMT, and then entered medical college. Speaking of dentistry, yes, dentistry stood out to me out of all other medical departments in healthcare because it's not just about science. Dentistry is a combination of science with your art, precision, and creativity. Though it's a bit challenging, it's not just about treating diseases, it's also about like restoring smiles, confidence of overall well-being. Dental college, it was a 5-year course, including 1 year Rotary internship that was compulsory. The first 3 years were more of medical subjects that is similar to the MBBS curriculum. We studied about anatomy, physiology, pharma. I understood that dentistry is not just about teeth, but is also connected to overall systemic health. Final year and the internship were mainly focused on dental subjects, clinical postings, and case discussions.
That's a wonderful journey, and it's beautifully highlighted how early curiosity can shape a meaningful career. Dental college often brings both challenges and opportunities. What experiences or habits during college helped you grow, not just academically, personally and professionally?
Honestly speaking, dental college taught me a lot beyond books and exams. College has a great patient exposure. That is an important factor in selecting your college. Talking to people from different backgrounds, understanding their problems, making them understand your procedures and treatments. This helps to build your communication skills, which will eventually help after your college or when you start your own practice. Another important thing I learned from my college is teamwork because we used to be posted in clinical postings and case discussions. We had to work with our team. The college was very stressful. Sometimes you feel overwhelmed. You have to build your patience, confidence, and ultimately you will become a very good dentist.
That's great reminder that growth in college goes far beyond textbooks and exams. What should parents realistically expect during their child's dental education, both academically and emotionally?
Parents should understand dental college is not just fun. It becomes stressful at times. Student feels overwhelmed, stressed. Sometimes they doubt themselves. Self-doubt is very common in dental college or even in medical college. Parents had to support their child in any condition, whether they pass or fail in exams. They have to support them. They have to understand their problems. They should never compare their children to other students or even to other courses as well. Because dentistry is like a difficult education as well as the profession is also very difficult. Parents have to build their own patience as well, like students, to support their children.
Thank you for addressing this, ma'am. It's extremely important for parents to understand this support journey. Moving ahead, when you started your journey into practice, how important did continuous learning and skill upgradation become in shaping your dental career?
After passing from my college, I just realized that my journey in dentistry has just started. because the college was just a foundation to me. You need to practice under some seniors like professionals or senior dentists. So continuous practicing with them, observing them, how they communicate with their patients, how they explain their treatments to patients. You have to watch them very carefully, which will help you to build a strong foundation for your dental practice. Working with senior professionals, and there are certain advanced courses in dentistry. You can opt for them. If you want to specialize in any dentistry field, you can go for that. Continuous working, going through your books, speaking to your mentors, and learning with them will help to build a great foundation for dentistry.
That clearly shows how staying updated is essential for long term success in dentistry. What should students focus on more, certificates or real clinical exposure?
Clinical exposure is a big win. Certificates look good on your CV. It's important academically. Dental practice, it's a skill based profession. So it's not just about medical knowledge. You have to practice. Working on a patient under some supervision will ultimately help you to gain experience. Just by learning and going through books will not help you. Experience will matter a lot.
Exactly, ma'am. So that insight will help students make smarter and more practical career decisions. Moving ahead, what are the most common dental problems you see in children today? And why is early dental care important, even for milk teeth?
The biggest dental problem in kids is cavities. It was always a number one problem. This is mainly related to frequent snacking, juices, sugary and starchy foods they are taking. Quantity does not matter, but the frequency matters a lot. Continuous snacking and sugary touch with teeth will activate bacteria in your mouth and create an acidic environment that helps the bacteria to grow in your mouth and eventually lead to cavities and bad odor. Moreover, there are certain orthodontic problems you will more commonly seen in children, that is crowding and spacing in teeth. This is related to bad habits like mouth breathing, thumb sucking, or tongue thrusting. All these issues are preventable and manageable when they are taken care of in the earlier stages.
Got it. It clearly shows that many childhood dental problems are preventable and that caring for milk teeth early plays a crucial role in child's development. One daily oral care habit every parent should teach their child.
There are certain oral habits like parents can teach: brushing twice a day, once in the morning and once before going to bed. Frequent snacking is not recommended. Like parents should teach their children whenever they are having any meal or having a sugary food or sticky food, they should rinse their mouth after that meal. Parents giving milk bottles to their children while sleeping is not recommended at all, which leads to multiple cavities. Parents can also change their habits. They should teach their children how to brush properly within circular motions and understand that their children should visit dentists in regular visits, because this will help their children to eventually maintain their oral hygiene, and also they won't be fearing in visiting any dental clinic. This will help their children to grow with healthier teeth and gums.
Got it, ma'am. That's simple, practical, and easy for parents to implement. Thank you for that. So, what role does diet play in oral health? And how harmful are frequent snacking habits and sugary drinks, especially for children, as you said?
Diet plays a major role in oral health. Whatever we eat or how often we eat matters a lot. It directly affects the bacteria in the mouth. Like I said earlier, whenever we eat any starchy or sugar food, it activates the bacteria in the mouth, creates an acidic environment, and ultimately affects the enamel of the teeth, leading to cavities and gum problems. It's important that you should take more of leafy vegetables and fruits. Whenever you eat something, just rinse properly with water and brush at least twice a day.
That reinforces how daily food habits at home directly shapes child's oral health. Why are regular dental checkups recommended and how important is post-treatment care in maintaining the long-term oral health?
Regular checkups are important because at an early stage, we can come to conclusion if there are any cavities in children or in any adult in the tooth, we can find them and cure them easily. For example, if we are treating a cavity which is very superficial in tooth, it has just touched the enamel or dentine, the second layer of tooth, we can treat it by just filling the tooth, which is a 15 to 20-minute process. The patient won't feel any kind of pain or sensitivity. This is a very simple procedure. If patient does not visit dentist regularly, there could be a chance that cavity reaches the pulp, the inner layer of tooth. He'll start feeling pain immediately. There could be a chance he can feel pain and swelling as well. The procedure will be we can do root canal treatment or extraction, which is a long-term procedure. Cost will be more and the patient has to visit multiple times to the dentist. So this is preventable, creating multiple visits at the dentist after the problem.
That really highlights how oral health is an ongoing process where timely checkups and proper care after treatment together make a lasting difference. Dentistry is evolving rapidly with technology. How is dentistry evolving with AI and technology? And what should students prepare to be future ready?
So thanks to AI and modern technology, the industry has gone through a major transformation. AI tools are being widely used in dentistry these days. To X-rays, CBCT scans, digital prints are being used. We can catch cavities, bone loss, or other issues related to teeth and gums, which is much easier and with very less guesswork than just working with a naked eye. These days, AI-powered system paired with 3D printing helps to make crowns, aligners, which is very common these days. These perfectly fit into patient's mouth and are prepared much faster than their conventional methods. This is very convenient for patients as well as for dentists. And students who are pursuing dentistry should understand that they have to be comfortable with this new AI technology. They need to be comfortable with CBCT scanning or digital printing, intraoral scanners, because the future of dentistry is AI technology combined with human skills. Students who embrace both will achieve the most, will be the ones most prepared for the future or tomorrow's dental practice.
It's truly encouraging to hear how future ready students need to be. Moving ahead, to conclude, one final question for students and parents. If you were advising a 16-year-old student and their parents today, what would your honest advice will be while choosing dentistry?
My advice, if you are 16 and thinking about dentistry, first ask yourself, do you really enjoy helping other people in a hands-on way? Because dentistry is not just a science, it's also art, patience, and problem solving. You'll be dealing with multiple patients in real world, are sometimes nervous or in pain. You eventually have to treat them, have to understand their problems. Your empathy and steady hands matter a lot. Dentistry is a long journey. If you are ready for it, if you are willing to work hard, dentistry can give you a stable, respectful, and fulfilling career.
That advice will definitely help families make decisions. So, Dr. Savagnya, thank you so much for sharing your valuable insights and experiences with us today.
Thank you so much.
To our listeners, students, parents, and aspiring dentists, we hope this conversation helped you understand dentistry as not just a career, but a lifelong journey of learning and impact. This is Amita on behalf of EduAdvice signing off. Stay informed, stay inspired. See you in the next episode.